Introducing the African Diaspora News Channel app, your gateway to stories that's overlooked by the corporate mainstream media.
At African Diaspora News Channel, we cover stories that don't receive mainstream attention, and we serve as the voice to the global Black community. We are committed to informing and educating through the power of media, connecting the African diaspora one story at a time.
With our platform, we're helping to end injustice by exposing it.
Join us in standing for excellence in journalism and serving our community. Download the African Diaspora News app today.
COVID-19 seems to be back. I thought it was over until I saw 350 people are still dying from COVID every single week in the US. That's not a typo. 350 deaths. And here's the kicker. There are treatments and vaccines, but people are still dying. And so it's a bit worrisome and a bit confusing. What's really going on? And more importantly, how does this still impact us as the Black nation and the Black community worldwide? Let's talk about it. COVID-19 isn't trending anymore, but it's not disappeared. It's still there. Look at the statistics. It's just become part of our lives, quietly affecting people, especially those who are older, immunocompromised, or people that are not vaccinated. I mean, that is debatable, but that's what the reports are saying. And while this might seem like an everybody problem, it's not. Because once again, Black people are caught in a unique intersection: medical mistrust, systemic inequalities, and limited access. And I want us to just hone into that for a second. So what are the facts? According to the CDC in the US, about 350 people in the US are still dying every week from COVID-19. That's roughly 1,400 deaths a month. And that's alarming. It's alarming. Yes, it's lower than the peak in 2021, but we're still not at zero. And remember, these are not just statistics. These are actual human beings. Most of these deaths are preventable, especially with early treatment, right? Now, before I proceed, let's be clear. This isn't about pushing anyone to get the vaccine or not to get it. I know the COVID-19 vaccine has been highly controversial, with so many opinions floating around, from concerns about its effectiveness to the fears that it could actually make people sicker, to even those theories about population control. I've heard it all. I've seen it all. I was apprehensive. You know, at the end of the day, adults have the right to make informed decisions about their health. So yes, the vaccine does exist, but there should be no discrimination or judgment towards anyone who chooses to take it or not, regardless of their race, their ethnicity, or their personal beliefs. So it's to each his own. But we have to talk about what currently is happening. Now let's hone into the Black community in the United States. When the vaccines first rolled out, if you recall, the media kept saying that the Black folks were hesitant because of the Tuskegee syphilis study, which was a study from back in 1932 to about 1972 that negatively affected Black men. Now, if you want me to touch on this particular story, let me know in the comment section. I'll do a separate video to actually tell you what really happened. It was very shocking and very alarming. Now, while details of that study left deep scars, new research says that that's not necessarily the full story, that the real reason Black people were hesitant with the vaccine was lack of positive healthcare experiences that they've had. You see, Black people are living the reality of a broken medical system right now. The real reason many Black Americans didn't trust the vaccine was because they didn't, and they still don't, necessarily trust the doctors that are giving it, right? It cuts across. Research by UCLA showed that Black Americans consistently report worse healthcare experiences than white people. Less respect, less time, less empathy. And guess what? That leads to less trust and lower likelihood to actually accept medical advice, including things like vaccines, right? So when the CDC tells people, hey, go and get vaccinated or go and get treatment, what does that mean to someone who feels invisible or disrespected every time they interact with a doctor? What does that tell you? Let's be honest. The health system, especially in the US, still treats Black pain like it's exaggerated. Black mothers are still dying at 3 times the rate of white mothers during childbirth. That is an alarming statistic. Black patients are less likely to be prescribed pain meds even when they're in the same amount of pain as white people. And so we've seen the reports. We've heard the stories. I've had my family in the US complain about this. So is it really shocking that Black people hesitate when they're told to trust the system? Here's the hard part. This mistrust is costing lives, unfortunately. Older Black adults, immunocompromised folks, people in underserved neighborhoods, they're at real risk, especially with this increase in COVID-19 cases. And because of vaccine hesitancy and poor access to care, many don't get the help that they actually need on time. But if you don't have a doctor who listens or access to one at all, you miss that window, which is unfortunate. The window to actually get early treatment. And for too many in the Black community, that's the difference between life and death, which is so scary. When it comes to Africa, right, the COVID-19 pandemic brought its own unique set of challenges. While the continent didn't record death rates as high as other parts of the world, the impact was still deeply felt, from strained health systems to economic downturns and disrupted livelihoods. We're still making up for it till today. When vaccines became available, African nations initially struggled with access, relying heavily on donations through initiatives like COVAX, right? You heard about that. But even when vaccines arrived, uptake was slow. Many Africans were skeptical, not just because of misinformation or conspiracy theories, but also due to deep-rooted mistrust in certain government systems, healthcare infrastructure, Western intervention. Highlight the Western interventions. Some questioned why Africa, which wasn't the epicenter of the COVID outbreak, was suddenly flooded with vaccines. It was scary. Others were wary of being used as testing grounds. That said, public health officials, influencers, and international organizations, they worked really hard to actually increase awareness. And over time, more people began to accept the vaccine. Though hesitancy remains a challenge in some regions. Yes, people accepted the vaccine, but if you take a look at the statistics of people compared to the statistics of people that didn't. So what's the solution? Let's hone into the US for a second. 2 things are needed urgently. Better access to vaccines for those who want it, and also better treatments in Black neighborhoods. Not just pop-ups during elections, but sustained, respectful care for the Black community. Medical professionals who see us, who hear us, and treat us with dignity. That's how trust is actually built. And for those watching who don't trust their doctor, use your voice, share your experiences, encourage your family, help bridge the gap. Because when we do protect ourselves, we survive, we thrive, and we lead. Now, COVID-19 may no longer be the headline, but it's still a crisis for many, especially in different communities across the world. So let's not wait for another wave before we begin to act. Let's protect ourselves, and more importantly, demand a system that protects all of us. Whether you're in the UK, in the US, in Nigeria, in South Africa, we must demand systems that protect us before any outbreak whatsoever, whether COVID or any. And I'm hoping that nothing like that happened, because that was one of the most traumatizing experiences for a lot of people who are still trying to get over what they experienced during the COVID era. And if we're seeing these different numbers rising in America, in Asia, particularly in Asia, the numbers in Asia are alarming. If we're seeing that happen, it means we need to start buckling up, because we cannot afford another COVID era. We just can't. The economy is barely getting over what happened during COVID. We can't afford that. So if we could see that the numbers are rising, it's time to buckle up. It's time to demand better healthcare from our governments around the world to ensure that everyone, particularly the underserved communities, are being taken care of. What are your thoughts about this? My name is Ify Igwe. Don't forget to like, share, subscribe.